Hello guys, welcome back again on our YouTube channel. You know our channel is all about eye health, and on today's video I'm going to discuss the use of traditional eye medication to the eyes. First of all, I am mad in my spirit to those that use traditional eye medication like palm oil, breast milk, sugar, herbs, all sort of things in the form of medication to the eyes. Some even use their urine, which is acidic, to put in the eyes. If you are that one person, please stop it, stop it, stop it. Now, if you are feeling like the eyes are painful, they are red, you feel like they are having discharges or itches, you don't need to look for that particular traditional eye medication that you are always glued to use. It is high time for you to stop it. If you are having painful eyes and you take traditional eye medication and put in that eye, what will happen is that the situation will increase. Know that the cornea does not have any supportive blood vessels that can nourish that part. When you put something there that is toxin, that is having toxin, when you put something there that is having toxin, it will cause more harm than good. And one thing you need to know about your cornea is that your cornea is the transparent part that helps to shine light to the retina for interpretation, for you to see properly. And if you destroy this part, if you destroy this transparent part, light will no longer pass through. It will become opaque. And so this is what traditional eye medication can do to this particular part of the eye. Immediately there is small disturbance there, light will no longer pass. Okay? Even those of you that you are having visual issues, that you need glasses, if this part is having a problem, they cannot do tests for glasses for you to see properly. So don't put traditional eye medication there. Why you don't need to put traditional eye medication is that, first of all, traditional eye medication is not sterile. Alright, they contain toxins. They contain bacteria that if you have infection, or let me say you have a scratch in your eye that has a bit of defect, then you put traditional eye medication, bacteria will enter that wound and start increasing the rate of inflammation and infection in that particular part of the eye. And at the end of the day, you are going to have what we call corneal ulcer. And when corneal ulcer enters and you keep putting that traditional eye medication, it will keep deepening the wound. As it deepens the wound, that eye might become perforated. And when it's perforated, that is vision loss. You might also have infection that can enter there, like what we call endophthalmitis, severe infection. It can enter there, and when it enters there, it can go right to the brain. And when it goes right to the brain, death can come. Not only visual loss now we'll be talking about, you can also be a victim of a corpse. So if you are that one person that you are putting traditional eye medication, if you are used to, when you have a bit of conjunctivitis, you rush, you take breast milk and put, know that bacterial growth is favorable in an environment where there is sugar. So if you are having conjunctivitis and you take sugar and put, the bacteria will multiply rapidly, thereby worsening the situation of that eye. Know that eye does not have duplicate. As you lost your vision, you lost it for life. There's no way that it can be replaced, unless the only thing that they can replace is the cornea, and you know the cost of cornea transplant is very, very expensive. So this advice goes to those people that they have refused in their life, that they will never go to the hospital when they are having a bit of itchy eyes, they are having a bit of red eyes, they are having a bit of Apollo, commonly called pink eye or conjunctivitis. Because they don't just want to spend, though we understand that in some situations, maybe the distance to go to the hospital is far. Some have decided to glue on traditional belief Some have decided to glue on the advice that their family members are giving them, that traditional eye medication, they are effective to the eyes. My brother, my sister, it is high time for you to rise up. Don't listen to any advice when you have an eye issue. Look where an eye hospital is and start going there before the situation become the one that they can no longer handle. Why I am saying this is because of this situation. Look at this situation. This is what we call corneal ulcer. This is what we call corneal perforation. Conditions are conditions that result because of some patients that put traditional eye medication in their eyes. And do you know what the traditional eye medication is? Urine. Urine that is acidic. They carry it and put in the eyes. And this is what it has led them to. Now their vision is totally gone. The situation is managed just to bring down the pain and for the eye to get healed so that they will feel a bit comfortable. But they will never see again with their eye. So if you are that one person that you always have eye issue and you rush to traditional eye doctors or you look for traditional eye medication around and put, it is high time for you to stop. If you have any eye issue, go to the hospital. If you are coming across this channel for the first time, please don't forget to subscribe, don't forget to like, don't forget to share. For those that have been contributing in one way or the other, I say thank you very much. Together we are going to grow and spread eye health to the world. I love you guys.